Well, thank you. Thank you so much for joining us today. We have Dr. Lynda and Dr. Krystle from Ashburn Children's Dentistry, and I'm going to turn it over to you ladies in a moment here. But I just wanted to tell you that I had a feeling this interview is like 20 years in making, because that's how long we've known each other. And I'm going to perhaps even share a couple of things, how you affected our lives. And by our lives, I mean my family here. And then I'm looking forward to learn more about what parents should pay attention to, what parents um, can like simplify for us what's out there and how to navigate this vast, vast sea of information. So if you don't mind just introducing yourself just a little bit, we'll have a whole full bio down in a link below, but just wanted to kind of turn it over to you and just introduce yourselves.
I'm Lynda Dean-Duru, and I'm sure as a parent, you've always wondered something, and when things don't feel right, and you know in your mind and your heart that something is not right. And so we help parents connect the dots. And I've been doing this, pediatric dentist, for over 30 years now. And we've seen a lot, we've learned a lot, and a lot of continuous education, things that you're not taught in school. But the message today is, as a parent, trust your gut.
Yeah, yeah.
And that was great. I'm Dr. Krystle Dean-Duru. I'm her daughter, and I've also been born into this field of trying to understand health and being able to help parents, help children be the best they can be. And so I've only been doing this for about, well, let me not say only, but it's over 10 years now. And in the dental industry for about 20 years, because I started off as a pediatric dental assistant. So this has definitely been a calling that I've enjoyed, and I'm just happy to be alongside my mentor to show me what is possible beyond what we learn from school.
And as a parent, who's seen only your practice, like both of my boys have been only in your practice, I can tell you that the way you approach educating is a little bit different than I've seen anywhere else. So I will forever remember that story when you told us, like, pay attention to your son's tongue. I was like, what is that? Like, how is that connected with anything, right? And I'm sure you're going to tell us about the tongue and position and everything, but our population here, the parents that I work with the most is either pregnant or looking to get pregnant or have young ones up to age 3. So this is where, in terms of development, everything is set in motion. I'm assuming it's the same thing with dental health and growing those healthy faces. Um, Am I on the right track, or how is this? What do you see?
You definitely are. Even just thinking about it when with your audience who are pregnant women, everything starts what we like to say 2 years before conception. So if they have a bundle of joy that's growing inside them, optimizing how mom is sleeping, how mom is breathing actually will affect how baby grows. So that in and of itself is something that we like to focus on even before the child comes out, and that is obviously rare because it's like we're dentists, we're only supposed to be focusing here, but in the mouth, but actually we are the head and neck in a sense, oral physicians, and everything does connect to the rest of the body. So
Yeah, and not many people understand that the tongue is the second organ that's formed after the heart. It is like 4 weeks in utero, it's already moving. So even before most people know they're pregnant, the tongue is already formed way before the brain differentiates, as a matter of fact. And that is connected all the way to the tip of our toes. And so it drives the development, it drives getting information, the nervous system, all through this whole body. So when I do ask those questions about the tongue, that's why, because when you have a mature swallow, that actually allows motion, and motion is life. It's life.
Yeah.
So can you help us then understand, go even back, like even further back? What does swallowing, you already mentioned breathing, how is all that swallowing, breathing, tongue, even posture, how is that connected with anything here? What does that do? Like we all want to know the SATs, the colleges our kids are going to go to, like are they going to be the successful people? So just guide us through that a little bit.
It's very complicated and complex, more or less, and it would probably be a very long Zoom call.
Yeah.
Yes.
However,
2 years.
Well, 20 years in making, that's why
Yeah,
it's
that's
said.
true. That is true.
I've tried to sort of kind of piece it together somewhat. And so as the baby is growing, it's already learning inside the belly, practicing the motions that it's going to make. It's practicing swallowing and all of that, and movement and all that and that. So when it comes out, that first cry is very important because that sets up the suck, swallow, breathe reflex. And so during that period, you open up almost like the cranial bones open up. And so, like say the cranium, like the skull, okay, you see the skull here, and it's got all sorts of bones on it. There's like 22 bones in the cranium, 14 of them are in the face. And as they're coming out is more or less, I don't want to say is mucousy, is soft to allow it to be able to come through the canal. And so even the process of traveling through the canal is getting the body ready for breathing, ready for all the reflexes that it needs to survive outside. So some things that will impair some of that can also affect how that baby now survives when it comes out. So that process of coming through the canal, say they came through like they're supposed to gracefully without having to have things like pitocin or anything that kind of forces more compression. Then they take that first big, huge cry that almost opens up the cranium and just have them, they're ready. You say when they say there's a breast crawl, they already know what to do. So they just gently crawl up and they find the breast. You don't have to show it to them. They find it and then they latch on. So that latch is a good latch, is also able to get the nervous system all stacking up. So during that period, the tongue is doing this. Is they're kind of going with the jaw and going, you see the shape of the jaw as well, the bottom jaw. And so the tongue is, this is how it's going to swallow and toward the front and back, but it's also pushing against the nipple to the roof of the mouth. And that helps it to widen and helps it widen the top jaw. And also that top jaw is connected to your nose, to the nose. The roof of the mouth is the floor of the nose. And some parts of your top jaw is also inside the eyes. So that also helps to balance the cranium, balance the cranial bones, and balance the joints as well. So yeah, and their back and their posture and how they're able to, they can't hold their neck properly during that time because everything is still trying to mush and get joint together to be able to align itself. By the time their teeth start coming in, their posture start getting integrated. And so by the time their first molars come in, they're ready to start walking. So all of that, everything is connected. So it's almost like your teeth are sending signals to the brain as well.
Teeth in the tongue.
Yeah, from the tongue.
From the tongue, yes.
Yeah.
Let me.
It's almost like what I'm hearing you say, it's almost like, well, we start with the basics, and based on the basics, we build on, and then we build on, and then we build on. And if the basics are not right, you're going to be building on all crooked. Yeah.
Exactly.
Yeah.
Exactly. That's the perfect way to describe it.
Yeah.
Yeah. And with,
Logically too.
where would you say it all starts? Is it with that proper latch? Is it with that? I know it's a complex question because I've asked you so many times before. But is there more like a simplified version you can give us? What can parents pay attention to, and where does it start? Is it really, I see parents who give up on breastfeeding because it was problematic, and problematic can mean so many different things, you know, from improper latch, which is just a simple fix that nobody showed him how to really just issues with the structure of the skull, essentially, or nipple function or whatever. So can you tell us a little bit about that?
Yeah, absolutely. So let's just say whatever happens when the baby is being made is what happened. So none of us have a lot of control over that in a sense. But as the baby is coming through, there's some interventions that are necessary as well. And so those become almost like trauma. Birth is our first natural trauma, period. And then when we have interventions, like sometimes you have the C-section, or they have to have Pitocin so that they can get labor to go on, or sometimes they have to be extracted with a forceps or vacuum. And so we can share some now. Yeah. So very well. There you go. And so some of those things will change the shape of the skull and also impact some tension. So if you imagine it, there's already contractions that as the baby is coming through. And now when we add something like Pitocin, then there's more forceful contraction, which also now compresses a lot of the bone and the fascia. Most of the bones are covered in fascia. And fascia is like the saran wrap that wraps our whole body. It's almost like when you're peeling up chicken, that little thin layer on. So that's what fascia is like. And our whole body system is covered in it. And it's got a sensory issue and sensory material in it. It's got nerves, blood vessels. The nervous system everything is covered in fascia. So when you have that compression, it's really supposed to glisten and move easily. That compression congeals the fascia, and that makes it harder for the nerves to travel properly and give messaging to the rest of the body as it should. And so as we talked about that trauma, the vacuum, forceps, even some of the kids come out with cord wrapped around their neck or cord wrapped around, some come with their hands on their face. Anything like that will also cause compression. And so the important part about that is the two very important nerves that come out from the back of the head. And that area is called the occiput, the back of the head. It's called the occiput. And so when those get compressed, then it's harder for those two very important nerves to be able to function properly. One of them is the hypoglossal nerve, which supplies the tongue. And the other one is the vagus nerve, which is your rest and digest. That's a big nerve. And so when those are compressed, they're not able to deliver the messaging as well as they can. So a lot of times when the baby is not able to latch, you got to be asking, okay, what's happened to that baby so that he's not able to latch or she's not able to latch, because they're supposed to be able to do that naturally. And so you consider those first, consider the input of the nervous system first. Most people go think, oh, there's a tongue tie, and quickly go, let's go get cut. That's not the right way to do that. You got to look first to make sure to optimize the nervous system. And then if it's not, there could be a structural restriction. So some of the things for parents to pay attention to, breastfeeding is not supposed to be painful. If it's painful at all, forget there are super moms, they tell me their toes are curled up, but they don't think it's painful, you know? So don't be a super mom, because if you feel like you have pain or need a little discomfort, that baby has 3 times as much discomfort as you're having, because they're trying their best to get food some way that should be easy and natural for them. So if you have a latch that is painful, don't sit and bear it. Get help. There's help out there. So some of the other things that moms should look out for would be if the child is now staying on the breast, they're kind of slipping off. or they have difficulties swallowing the milk, or they're chumping, or they're clicking, or they have reflux, or they're colicky, or they're spitting up. Now, spit up is not normal. The sit up is not normal. Sit up usually means that there's that compression of the vagus nerve, or they're swallowing too much air. And both of those are not normal. If they're swallowing too much air, that means they don't have a good latch. They're not able to create a seal so that they can easily transport the milk as they're pressing them out from the breast. So if the kid is also has like a preference to one side of the breast, that's more likely to be torticollis. And again, or they're just inconsolable. So those are some of the things that should make a parent or mom understand that there's something not right. And again, it's not necessarily a tongue tie. It just means the tongue is not functioning well. And so figure out why that tongue is not doing its job and then fix that. Said a lot of things already.
And I remember again that tongue going through this with both of my sons actually going through something called myotherapy, which you do, and I'm sure you're gonna tell us about that as well. I remember with my younger one, you told him he has to have the right position of the tongue because when he touches certain parts of the palate, his whole brain is going to light up. And I remember him saying, well, I did it and nothing lit up in my head. So what are you talking about, right? So it's one of those things that that position of the tongue became really fascinating to me to hear about. So can you tell us more about the nerves? I understand the positioning and mechanics for the bones. What about those nerves and why is that important?
Okay, so then we talked about the nerves, the ones that supply the tongue and the vagus nerve as well. But also having the tongue on the roof of your mouth here, maybe I show it better on the skull. Having the tongue on the roof of the mouth is when you swallow, that back portion of the tongue pushes up on an area here that is called the SBS, it's the sphenobasal symphysis. And that goes directly into the brain. So remember when I said that our bodies depend on motion. So the pumping action from the tongue pushes up into that goes into the brain and gets the cranium moving and helps it to get the things like dopamine, serotonin, the good feel hormones that help you to center yourself. It also helps to get rid of waste products from the brain. So that's called lymphatics. So if your tongue is not working properly, then you're not able to do those. So if you have motion in the brain, the signals go out easily. And so can I ask you now, did he find that his brain lit up when he started getting his tongue done?
He's definitely doing much better now. I can tell you that even at school and just thinking and just clarity, everything, paying attention more. We still have a little bit while to go with you, but yeah, it's definitely better now than where he was before. Yeah.
Yeah, I remember him coming back and he was getting A's and B's and stuff, and
Yeah.
even you saying, "Oh my goodness, I don't even have to help him with the work anymore." So, yeah, it does matter. And the younger they are, the easier it is to get things online. And the older you are, the more difficult because over the years you've learned to compensate. You've learned to do it different ways. And it's not that they're sick, it's just that they're just surviving instead of thriving. So,
Yeah.
yeah.
And I remember you talking a lot, like when I attended some of the talks that you two gave for the community and the providers, it was interesting to see that not only the tongue, but position of the jaw was extremely important as well. Can you tell us more about that and what should parents look for? What does it mean to have a healthy baby that's latching on properly, has the perfect position of the tongue, has the jaw that's developing correctly versus what to watch out for?
Great question because it does start off in infancy, does start off toddlerhood, where if the tongue is positioned the way it should at the roof of the mouth, and the muscles are relaxed around it, that means that the jaws will be growing forward. And the importance of that is that there's more of a proper airway developed behind the jaw, or behind the tongue, which is important. And then also the development of the nasal structure, right? So not having a narrow palate, so to speak, because your tongue is resting at the roof of your mouth properly. Not having a narrow palate will mean your nasal structures are also formed properly, where you have the tissues there aren't swollen, aren't kind of cramped in there because there's no room. So all of that is important for the point of mechanics and engineering of our body. It allows us to breathe properly. It allows us to breathe efficiently. And the efficiency of breathing allows us to get more oxygen to the brain, oxygen to the body without having to work hard. Now, if our mouths are open, or if baby's mouth is open, toddler's mouth is open, just kind of sitting like that, that means they're breathing more through their mouth, not allowing for proper oxygenation of the air. So yeah, if they're breathing through their mouth, they're just getting cold, like cold air, unfiltered air, and the body's having to do a whole lot more work to get oxygen to the brain, oxygen to the rest of the body, right? And oftentimes too, the nasal structure is like a use it or lose it, like an attic with a whole bunch of dust. It becomes even more kind of sick and congested, and it's a bad cycle, so to speak. Now, the other part, as far as structure of the face, if the mouth is open or if the tongue is laying low, that means it's pulling on the jaws and making the lower jaw, which is separate, which is typically separate, right? So that means it's governed by muscles, tongue muscles, cheek muscles, things like that. So if the tongue is laying low, then it's gonna be dragged down. Dragged down, that means it's gonna be sitting closer to the airway, right? And further blocking that, further creating just a cycle of dysfunction for the child. And they continually grow in that dysfunction, which then starts to it has a domino effect throughout the entire body. And as we talked about before, having that jaw and the teeth sitting properly where they're supposed to, because everything grew in the right direction, also means there's stability in the neck, which then means there's stability in the body, right? So it becomes a domino effect when the initial building blocks, which is having the tongue at the roof of the mouth, due to proper breastfeeding, having a nice U-shaped jaw, flatter palate, a nice nasal structure develop. All those things are building blocks to being able to have a stable body, stable mind, and allow for the engineering, so to speak, of the body to be more efficient.
Yeah.
So, yeah.
And also when the teeth start coming in, they can come in properly. So as a teeth, for all the kids, they should have like picket fences between their teeth.
By age 2.
By age
By
2.
age 2,
they should have all the teeth have like picket fences around their teeth. And that just tells you, okay, that jaw has developed well and it has space to fit the adult teeth. So if the child does not have spaces, that's trouble. And
there's crowding.
or they're already like crowded as a baby, there's a lot of trouble. So so parents should be on the lookout for that as well. And if they notice that early enough, which sometimes you can see by 8, 9 months of age, because some of the teeth have come in and they're all like close together, they should be looking and going, this tongue's not working like it should. What's going on? And sometimes they can actually hear their kids breathing. Your breathing is supposed to be silent. They're not supposed to hear them breathing. And sometimes they'll hear them snoring. So something is not right when you see all of those kinds of things. Yeah.
And you mentioned that we can take it from any which way here, because there's so many points that you brought up now for parents to kind of pay attention to. But let's just stay on the breastfeeding versus bottle feeding route. we do have parents that either cannot breastfeed or choose not to breastfeed. What do you see and what do you suggest? Like, how can they minimize some of those impacts? What can they do?
Great point. And sometimes breastfeeding, either by choice or medical reason, for whatever it is, it's not possible. And there's no shame in that either. And so if you do the best you can and just see the most you can get from the development for the baby. So sometimes people in some cultures, they see they feed them with an open cup, which is actually, you get less dysfunction that way. But in our civilized culture, it's gonna be hard to tell a mom, sit down and feed and cup feed this baby, right? So if you're going to bottle feed, I usually suggest find a nipple that is more shaped like the breast, but it does have like it goes that it slopes gently. It doesn't have a stop because you want to get as much of that nipple inside the baby's mouth as possible. So if you get a really good nipple, the ends of their lip will be at the, and what do you call that? It's not the shim, like almost
Yeah,
like
the
the cap.
plastic ring base.
Yeah, the
That's the
rim.
thing.
Yes, yes, the lips should be over the rim and just flange out over the
Mm-hmm.
rim. And
Mm-hmm.
so all of that nipple is inside their mouth. So now their tongue will have to push up to get the food. When you get a nipple, most of the nipples I see on the market, they have a stop or they're tiny. Then the child will start to try to use their jaw to lift their tongue,
Mm-hmm.
even when their tongue may be working properly, but the shape of the nipple is not enough to help accommodate what they need. So they'll start using their chin to push up. And everybody try pushing their chin up. That's tough. That's hard. And so they get tired easily. I had one mom tell me, oh, the kid is just dramatic. And I say, no, they're tired. They just pull their chin up to try to suckle. It's too hard. So they have to take breaks on that. So that's another thing for a parent to know, okay, this is not proper because they, taking in the chin and taking break and you hear the chomping noise or clicking noise even on the bottle. So choose a bottle that just slopes easily. I don't know. There's one that I used to like. I don't see it anymore. It looks like they don't make them anymore. But we're happy to share the shape. I'm not here to. I don't have any stock in them, but I wish I did. But anyhow, but the way it slopes easily, so there's not a quick stop for the child to just try to use their
Yeah.
lips to suckle instead of using the whole tongue to do it. So it is doable.
So that's the kind of replacement, so to speak, that would happen. Although there are lots of benefits to that skin to skin. And I think if a parent is unable to do it, that they should consider, and I know there's not many around, but even finding professionals that will then start to help guide as well, because there are things that are missing. And so having, it's okay to feed the baby, but then there's also the function part that's really important to all these things that we're saying as far as guiding growth. Finding a professional that starts helping with like a myo munchie or baby munchie or some kind of something to then replace what could have been missing from having the effects of proper breastfeeding.
Yeah, what about, well, since we're on topic of bottle feeding and bottles and nipples, what about pacifiers and sippy cups?
Okay, all right.
So in one sentence, right? Like this huge complex thing in one sentence.
Okay, I'm biased because I am not a fan of pacifiers. I'm not
Okay.
a fan of them. I do know that some pediatricians recommend them. They say it helps to prevent SIDS. My mind is going, why are we thinking SID in the first place? If it's SID, then the tongue function is not right. So anyway, but if you have to use it for your mental health, please do. And just as long as you're able to stop using it by 6 months of age, because by the 4th month of age, the brain's ready for the chewing reflex. And so a lot of the reflexes you have as a baby that would start to transition. So you don't want a pacifier in there because it's going to delay the ability to start getting their reflex to get a mature swallow, which is the basis of your health.
Mm-hmm.
Yeah.
Same thing.
So, yeah, definitely noticed.
Yeah.
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 Mhm.
Yeah, and it's interesting also to see when I see moms, because I run support groups as well for moms with the babies and up to age 1. There are less and less babies with pacifiers. So that's, on one hand, that's great to see, but then we got to also inform them and educate them why, yeah, keep doing what you're doing, mama, and this is why, and this is what you're doing for the baby. And you also mentioned Maya munchies and baby lays, baby munchies.
Baby
What did
munchie.
Baby
Baby
munchie,
munchie.
baby lace.
Can you tell us more about that? What is that?
So my munchie is a tool, one of the tools in our toolbox, and it's almost shaped like a jar, and it has little. It's made out of silicone kind of material, and it's got some projections in it. So those make it. It's almost like stimulatory for the baby. And so when you use it, when we use it early, we're not doing it so they can chew on it. We're
Mm-hmm.
actually using it, the babies actually would use that. I have parents pin it on their shirt instead of the pacifier, because already the parents I do see are parents who have issues, right? When that
Mm-hmm.
baby is 2 days old, they have trouble. Those are the ones we see. And so knowing that things already occurred like before they were born, we're working behind the 8 ball to try to get them to neutral so they can get back up in there. So having them get some stimulation as they're preparing their tongue to do the work is important so that they can use the munchies. A lot of them will chew on it. Some of them, if you put it inside their mouth, they actually will be, they just changes their outlook. They're happy, they're smiling. But what we tell parents to use it mostly for is train for lip seal, because if your lips are together, then you can nasal breathe. Your lips are
Mm-hmm.
together, the tongue is up on the roof of the mouth, and you can nasal breathe. So that's what that is. Then baby laser is a non-surgical laser that helps to loosen up that tight fascia that we talked about.
Mm-hmm.
So we use a cranial osteopath to help with that as well. Some people use cranial sacrotherapists. Some people use massage therapists. Some people use physical therapists. Some people use baby-friendly chiropractors. But I'll say find someone, first of all, who understands that baby needs and knows has baby hands, and
Mm-hmm.
also understand the neurological input that this time of life requires and pays attention to that.
And looks in the mouth as well.
And looks in the mouth as well.
Yeah, the
So
palate and the tongue.
yeah.
Yeah.
Mhm.
And I hear from parents, and of course from you as well. The parents usually go, first step is go to the pediatrician. Pediatrician recommends go to the ENT, the ear, nose, and throat doctor. The ear, nose, and throat doctor will evaluate, do the cut, and then send the baby home. It is a little bit, without knowing about this stuff. That's why we're here and talking about this. It's not always the most optimal solution for the kid, right? For the baby.
Yeah, it's problematic, but I just ask parents to have some grace for
Mhm.
providers who don't know. Because first of all, the pediatricians, they don't get this training in school.
Mhm.
Neither do dentists. We don't get this training in school. I'd say the only people who actually probably understand this as a whole will be cranial osteopathic physicians, because
Mhm.
they know that motion is life. They understand that how that baby comes out will determine their function for the rest of their lives.
Mhm.
So if I had a magic wand, I would say like there would be an osteopath at every delivery. So
Mhm.
because that's going to shape, they see how that baby comes, they already know what systems are going to be affected, and they can easily help that baby get back online quickly. Anyway, so when the pediatrician says it's okay, just feed the baby or just go to the bottle because you're having pain, it's not, they don't know. And so, first you want to find the lactation consultant who can at least maybe help you with positioning, see if that helps it as well. And for the ENT, they're surgeons. So if it's not bad enough to cut, all is well. And so you can't really blame them like that. So we know development, we know growth. And so for a lot of us pediatric dentists, it's already a foundation, but not the way that now we understand it. that, oh, it gets affected even before the baby is done. And as the baby comes out, you can already see the signs if their growth is not going in the right direction. And so,
So yeah, we're not a big fan of just what they call snipping or, the tongue tie, the restrictions, just because we know that every restriction, it's not just that tie. There's something to it, something more going on. And the surgery is important to help that structural aspect, but also the function, the not neurological component that goes into the nervous system of the entire body, the tongue being connected to the tip of the toes through body fascia. And it's even more important as you have an infant there, they're really affected by that full body connection. Just cutting, snipping, and not seeing them again is really something that we're wholeheartedly not a fan of. And we haven't been since being released providers since 2006. And so it's really important that for parents, when they are, if they do get a pediatrician that says, oh, there's something going on, see an ENT for cut, I would say give kudos to the pediatrician for even recognizing the restriction, but maybe consider going to more of an integrative pediatric dentist that does a bit more comprehensive evaluation with regards to infants, everybody, but infants mostly, for the oral tie restrictions and things like that, just because it's not just the surgery, because that's not going to be a magic. A lot of parents find out they do the ones, sometimes we get about 20 or 30% of our patients are revisions from things that have happened before. And you don't want to be putting a child through that, but sometimes you have to do something to help that restriction. We have to open up the lens of what you're looking at and why you're doing what you're doing. So
And I like the recommendation there, who to go and see, because you don't necessarily, with the brand new baby, you're not necessarily thinking go and see a dentist. You're not seeing, that's not your first line of providers that you will call. It's usually pediatrician followed by whoever the pediatrician sets,
is to go to,
yeah,
right.
recommends. So what kind of, I guess it's moving into the future so we can look back at this time. I can only speak from our experience here as a family, because my two sons, one is almost 20, the other one is 15 at the time of this recording. One of them, we did hear him snore as a newborn. We did have, a lot of stuffy noses, allergies, dark circles as he was growing up. And every time we brought it up, it was like, he'll outgrow it. And I remember you always saying, well, let's just go and check what's going on, because this is not, he's not going to outgrow this, to the point where we started a process later, and he had severe sleep apnea, and his tonsils were filled with rocks essentially because of all the infections he was battling, and that was taken care of, and a lot of things just resolved. I mean, he had to do some other stuff as well. And with the younger one, we started it much earlier, but his was more mental, like with the anxiety, with the not being able to think clearly, and maybe not so much migraines. And with my older one, his neurologist said, no, this is normal for boys to have migraines. And my head is like, how is that normal or common? Not normal, not normal. He didn't use the normal, common. Yeah. So it's kind of like, well, that doesn't seem normal to me, as a parent, for him to have that bad kind of reaction to anything, really. Can you tell us more about that? What do you see? What can be done later if parents are watching this later?
Very great question. And actually, you waxed it all together. And as you were saying that, I go, this is why I'm here. This is, I'm a surviving sleep apnea patient, recovering sleep apnea patient. And part of the reason that we're so passionate about this and getting into intervene early is the fact that I was dependent on CPAP for 7 years. I had migraines all my life. I thought that's how it was. I haven't been on a CPAP now for 3 years, and I haven't had a migraine in 3 years. And part of that is that I'm in therapy. I'm doing all the work myself that we're asking the children to do. And I look at pictures of me at 9 months of age. All the signs were there. And so that's why I know you don't outgrow it. You grow into something else. For me, it became the migraines, anxiety, and I thought I was all that. I mean, I didn't have braces. I did well in that department per se, but still there wasn't enough space for my tongue. And part of why my teeth looked nicer was because my tongue was actually pushing forward, pushing everything forward. So that it's not in juicy bone, so it's not as healthy as it could have been if my tongue developed properly and made the bony foundation for me. Right. So that makes you more prone to gum disease or more prone to you get fillings or you get crowns, they don't last. That you're always redoing stuff, or the kids always getting cavities and things like that.
Clenching.
Oh, clenching and yeah, like clenching and grinding. Yeah, clenching and like bad. Anyway, so those are some of the reasons that it's important to see and go get help early. They have the dark circles under their eyes. They're constantly tired after they've had 11 hours of sleep. They wake up, say, I'm tired. The bed looks like a tornado in the morning. So, but you say, oh, they sleep well. No, if they're tossing and turning or moving around the whole night, they're not getting restful sleep. And some kids are still wetting the bed at 9, 10, 11, 12. That's not good. That's all true. The nervous system is not in balance. So you have to have someone check that out for you as well. Obviously, the very obvious one is a crowding. And I think that's what most parents, that's when they start thinking, let me see the dentist, the crowding. Actually, when the baby is born, they're already expecting college, wedding, and braces. But nobody's asking why do we have to have braces, right? So when the parents see that the teeth are crowded, when the permanent teeth start coming in, by then it's already far gone. Because 50% of the jaw growth is done by age 2. So you want to capture as much of that as possible. After age 2, you're playing catch up the whole time. Really. So yeah, that's that. And then sometimes in school they can't focus, they can't pay attention. Sometimes they diagnose them with ADD, ADHD, but the studies are there. There's studies that do say that ADHD and lack of sleep, they have the same symptoms. And most of it has to do with your craniofacial growth, which is how your jaws developed. So that tells us that if I were a parent, before I put my kid on medication that changes their brain chemistry, I would have someone check their sleep and check how their jaw is growing and how their tongue is functioning, because they're all related. Sometimes you get that better and they focus better. Sometimes the kids that they were nonverbal, they start speaking, they start making sense. It was too much work. Their bodies have been going, they needed a whole D battery to function, and you just get them a AAA battery. That's hard to survive. But they do it. They're not thriving.
You just reminded me of this one parent who, especially with the tossing and turning in the bed, looks like a tornado. She just told me recently, it was like, what do you think? Like my daughter, who is I think 8 or 9 at this point, she is so bad behaved. She is so bad behaved, and she's always been one of those kids that was crying all the time as a baby and was constantly tense and angry, and now sleeps with the sheet over her head. Like cannot, if you try even in the middle of the night to uncover her face, she's constantly like, no, 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 I want that back over my head. So it's like, I don't know, do you have any suggestions? I'm like, well, go see you first of all, but they live like 5 states away.
Yeah.
And so that's not possible for them, but is there something that you would tie it to potentially to what you were talking about?
Well, first things that, we get an accurate history. I want to know what happened to that baby as it was coming through, right? And so she's already older now. We can actually take a CBCT scan, which is a 3D scan that goes from here to the neck. and we're going to be able to see like what's going on in the face. What's going on with the sinuses, what's going on in the nose, what's going on in the jaws, what's happening with the airway, tonsils and adenoids. So those things we'll be able to kind of piece together now and be able to say, hey, there's something that is going on. It could be with the jaws, it could be with the nervous system, it could be with all of them. And
Mhm.
so we generally act as quarterbacks because we don't treat sleep. However,
Yeah.
we know that when we get the craniofacial structure, which is the around the face, when we get the face building correctly, sleep gets better.
The
Right?
muscles.
And the muscles, treat the muscles and get the jaws growing properly, sleep gets better. The breathing gets better, those things as well. So it's important to understand as a parent that how well you breathe and how well you sleep for your ever life depends on how well your face grows. So yeah, for that mom, she really needs to find, and I want to use this term loosely, an airway focused dentist, because not all of them are as comprehensive. Some of them I just want to do, let's do expansion, a rapid part of expanders, but our bodies are not symmetrical like that.
Yeah.
So you can't just like rapidly do something to create space, because that's not how the body grows, really. But sometimes it helps some symptoms like right away, but you have to understand that there's more to that picture. You got to worry about nutrition. You got to worry about their posture. I've obviously talked about the nervous system. You got to worry about what have they done to compensate? What behaviors do we need to untrain for? And yeah, think about what else is there? I got so many things in there. No, I
Behavior,
can't.
nutrition, posture, nervous system.
And nervous system, and then who else can we get to help you, right? So as a quarterback, our licensure is from here to here, from neck up, but neck up is connected all the way to the toes. So sometimes actually it's something on your hip will be keeping you from breathing properly or from your tongue functioning well. So we've got to get some other providers who understand that, right?
Full integrative health.
Yeah,
That's just how it's
exactly.
supposed to have been anyway.
Yeah,
Yeah.
yeah.
So,
And sleep always comes into play, teaching babies how to sleep properly. It's always the topic of discussion. In one of the what makes me happy is to hear that more and more providers are at least hearing about this and are kind of sort of getting idea about this. One training that I'm currently part of, it's all neuroscience of the infant brain, developing healthy brains. The first thing they said about sleep was check the breathing, check development of the face. You got to do that. You got to find a provider, like have them in referral network of yours, because a lot of parents don't recognize how important and crucial that is. It's not just, cutting and proper latching and everything. So that's
Yeah.
promising.
that's amazing. Yeah.
That's
It's
a
always
great
good
course.
to
Stay
hear,
with
right?
them.
Yeah. Stick
Yes.
with that course.
Yeah, I'm definitely sending that to you. Any final words for us? I'm sure we're going to be coming back and talking more as parents have more questions. But anything that we can tell parents to either pay attention to or do daily so that they can at least start to promote that healthy sleep, healthy breathing.
It's great. It's not all doom and gloom. And
Yeah.
obviously,
Yes.
it's a great time. We're just all we're trying to do is to help you have your child thrive, be the best person they can be. And so start with yourself. Try to see how you can regulate your own self. If you need to meditate, if he's getting really upset, just let him be and just get in a corner and meditate daily. Take care of yourself.
Yeah.
Make sure you're breathing well. Make sure your nostrils are clean so that you can get air going in and out, flowing properly. And then, of course, watch your nutrition. Okay, those things they already know. And when the baby comes, again, if you have pain nursing, and if it's your first time, you probably say, oh, I don't know what I'm doing and all of that. Okay, yeah, that may be part of it. But if you continue to experience pain, it's not you. It's not the baby either, but it's because there's the function is not correct. Something is not right with the function. Then seek help. Someone tells you that they're going to outgrow it, they usually don't. So just make sure that you're listening to your instincts and trusting your instincts. God gave you that for a reason. So don't let anybody talk you out of it, because you're going to be always right. You got to keep
Yeah.
looking until you find the person that helps you, matches how you're feeling it. And they're not quick to just go cut. They're not quick to do an irreversible procedure.
And
Mhm.
and this was awesome, Mom. I just wanted to add, because I know you mentioned the nutrition and you mentioned the just taking care of oneself, nasal hygiene. So and that's important for the parents. It's very important because all of that gets transferred, the energy gets transferred to the child, and they find it hard to, this is very real, they find it hard to regulate themselves already. But if they know mom and dad are having issues for themselves, they can feel all of that, and they're a wealth of energy there. But what moms and dads could do with regards to nutrition, because this is extremely important, more than it's is typically even emphasized, is just making sure that they're not eating a bunch of mush, they're making sure the infants and toddlers are not going into just a lot of, Gerber type foods that was supposed to be meant for people who are invalids that can't eat, right? Baby eats breast milk, and then soft food, then soft solids. And that's going to be very, very important in the function and the development of their face. So just making sure they're having the proper nutrition, which are the building blocks for their health and for their jaws, but also the type of nutrition is going to be what's going to help them in their sleep as well. There's certain minerals and vitamins and things like that that kids are just not getting. So doing that and keeping their nose clean, that's what they can do at home. Keeping their nose clean, checking the homes for mold, and aerating the homes. Getting some air. We're inside so often. I don't think it's something that we don't even think about. And so just make sure that we're aerating the homes, checking the homes for mold. Even new homes can have mold, things like that, because those things will start affecting how the body is it doesn't have enough nutrients, and then it's just not going to be able to function well at all. Even if you do get the structure and the function of the face okay, then they start the environment just affects how all of that works. So this is like the hidden hints that parents don't get, just keeping the nose clean and keeping the home, aerated environment and play. Yes.
And play.
Going outside and play. It sounds so simple, but we're seeing this part is really what's affecting kids today. It really truly is. So
And I'll add to that, just because you already talked, you were a guest in one of our groups. Just keep your baby's mouth closed. If you see them sleep with their mouth open, just push that jaw. Constantly just push it up. Teach them.
Right underneath,
gentle pressure.
You train them from early.
Yes.
Train them from early. Yeah.
Yes.
It makes a difference.
Makes a huge difference. All these things sound so small. It's like we kind of heard it, but the more we treat kids, the more we see the studies where it's so very, like, these are important things. They're extremely important. Yeah.
And I would love to have you back and talk to us about that, solids and chewing and how that works. Hopefully we can do that in the future as well, just because that in itself is just a totally different topic, how to ease kids into solids.
Anytime.
Yeah, and where can people find you? How can they get in touch with you?
Well, we are Ashburn Children's Dentistry, but also now Womb to Grow Wellness. And so we can be found on our website, www.kidsmile.com. On social media, we are Ashburn Children's Dentistry on Instagram, and soon we'll have a Womb to Grow Wellness, a suite of things to be able to help parents as well. But this is where we are. We're here in Ashburn, Virginia.
On a good old phone, 703-723-8440.
And I'll put all this information for parents to have. And how soon can they talk to you if they have any questions?
At any time. I think, we try to leave our doors open, just because we know there are a lot of
Mhm.
parents suffering. That's
Mhm.
the thing. And so we get inundated, but we do have ability
Yeah.
for new patients.
Yeah.
We're taking new patients.
Yeah, and they can schedule a complimentary discovery call
Mhm.
as well. So then we'll go over and see if that's something that our team will decide, or excuse me, our team will get information and we can see if that's something we can help them with. Or we'll just answer questions. We're happy to.
Thank you. Thank you so much for taking the time. And then we'll definitely be seeing more of you soon, I expect.
Well,
This is
thank
so
you.
good. Thank
Yeah.
you so much for having us. This was
We're
awesome.
excited. We're happy to share this. We
Yes.
want as many moms as possible to hear this. We want them to share them with their friends. They don't have to come see us, but they would love it if they could. But at least we want them to have the knowledge so that when they're getting dismissed, they would know inside of them that they have the power to understand that they are connecting the dots and that no one other than them should be the one, the ultimate decider.